Do you have anything to say? Don't you think someone needs to be held accountable for this?
Walking away from questions of responsibility. That's what CDC's Chief Information Officer Jim Seligman appears to do after the 11 Alive investigators uncovered millions of taxpayer dollars wasted in a failed computer project he oversaw. It started in 2010 when the agency hired a company called True Tandem to build a program called S3P. It was supposed to allow CDC scientists to share studies and enter proposed projects. But according to this internal March 2016 report, S3P lacks leadership support, has very little credibility, and could be shut down. 9 months later, the CDC pulled the plug on the program, wasting $5.6 million. William Perry is the founder of Georgia Ethics Watchdogs.
Well, I think you don't have to be an expert in IT or any other field to realize, based on what I read, that it was a colossal waste of money.
Getting the documentation to prove S3P failed wasn't easy. When the 11 Alive investigators first requested the report, the CDC claimed it didn't exist for weeks.
That behavior is the most troubling thing for me. It's the biggest red flag.
The CDC first agreed to an interview writing early afternoon on Friday, January 13th, but then canceled it the day before. So we caught up with Seligman recently while walking his dog.
Nice to meet you. I've been trying to get a hold of you for an interview for a while. Do you have a few seconds to talk about
right now I got to get to work.
Can you just talk to me a little bit more about the S3P project and why it failed?
So I have a card from our press officer to give you, but it's in the house.
Okay.
While the agency spent years wasting millions of dollars on a project that will never see the light of day, the 11 Alive investigators uncovered the CDC reduced funding to some of Georgia's most important health programs. According to the Georgia Department of Public Health, the CDC cut $781,000 from state programs, the majority of that for HIV prevention. Nicole Robach is the director of AID Atlanta. The HIV outreach organization receives 80% of its funding from the federal government. Over the past few years, she's seen a big drop in prevention funding, while HIV rates in Atlanta remain one of the highest in the country.
The epidemic is huge here.
According to one CDC study, 1 in 2 African American gay men will contract HIV in their lifetime. The CDC says funds for S3P could not have been spent on prevention programs. The agency funded S3P with IT and infrastructure dollars, which cannot be reappropriated. Still, Robach says if her organization wasted federal funds as CDC did, she'd be out of a job.
And I'll tell you what, if funded agencies like AID Atlanta had a similar result, I'm thinking my dollars would be removed from my agency because I didn't produce.
They certainly hold accountable the groups they give grants to, so they themselves need to be accountable. And somebody needs to answer as to what happened and why and what the consequences are.
A failed program which cost taxpayers millions.
Why did you guys cancel our interview?
And no one at the CDC
You have to talk to our press officer about that.
willing to talk about it on camera. We also uncovered the CDC continued to pay for the IT project for 8 months after suspending it, totaling $781,000. The agency says it was contractually required to do so. At last check, not a single CDC employee has been disciplined for the failed project. For the 11 Alive investigators, I'm Andy Parati.